Hi, and welcome to another episode of Pivy Does It All. Today I'm going to be doing a podcast, and I am going to be doing it on mental health. I have a mental health podcast that I have been doing for 19 episodes thus far. So today is episode 20, and I have my phone here recording, and I'm going to, actually, this is my wife's phone because I record my videos on my phone. So I'm going to record a podcast and record the video. Sorry for the mess. I have a bunch of projects going right now. You can see the trans flag right here. That's part of my pride costume. So let's just get started and dive into mental health. Um, if before we do that though, if you're looking for the name of my podcast, it's called Mentally Chill: Diagnoses, Neuroses, and Everything Between. And I've put that name in the description below. You can find us on Spotify, Apple Podcasts, pretty much anywhere where you find your podcast. We're there. So we've been there a while, but I usually go to Spotify just because I don't have an Apple phone. So it doesn't make sense for me to have Apple Podcasts. So I hope you guys enjoy this podcast. Today it's just me. Other times I will have guests, and we will let me button that. Can I button up more? No. I've been wearing my binder for like days straight, and so my boobs are like super tight to wear it. So maybe TMI. Sorry about it. It's just trans life. So let's get started. And I hope you guys enjoy. Hello, everyone, and welcome to another episode of Mentally Chill: Diagnoses, Neuroses, and Everything Between. If you're wondering why there's a pause, I'm also recording this on YouTube. So if you want to see the live recording, you can go to my YouTube channel, Pivy, Pivy, Does It All, and watch me be a fool on there, as well as listening to me. So it's up to you whether you prefer podcasts or whether you prefer videos. I know I personally am a video person, so that's why I wanted to bring the content to both video and and um, podcasts. So today I want to talk about my current status of my mental health. Um, I was wanting to talk about my mental health because it's not really in a great state right now. Um, I am currently out on short-term disability from work for my mental health. And a lot of people don't know that, or haven't really talked about it much because I don't really, it's not something I'm terribly proud of, even though it's something I can't help. If I could help it, of course, I wouldn't choose to be out on disability, but I had to make that choice for myself when I could no longer do my job. And that's just the unfortunate truth of it. So, right now, what I'm dealing with is medicine withdrawal and tapering off because the medicine is causing me to have cognitive impairment and slowed thinking. Literally the doctor's words, they gave a note to my employer saying that. So it's not just something in my head. It truly is, I mean, it is in my head, but it's truly something that's going on in my life. So I not only does it cause cognitive impairment, but it causes slowing of movement and talking. And I've had several comments saying that um, my wit and my comedy has slowed down. I physically have slowed down when I move, which is hard for me to notice because, I mean, all of these things are really hard for me to notice because to me, I feel like I'm moving at normal speed. And how could I have the perception to know that I am moving at a different speed? For those of you who've been with me for a while, you know that this was a problem in the fall and with a different medication. And so it really, really sucks to have this happen again. And this time I'm not going into treatment because I don't feel like I need it. I just need to wean off this medication, which is having some nasty side effects on me. And yeah, so that's mukbangs and more. Hi Zach, hello. Today we're talking about mental health and doing a podcast as well at the same time. So we are I have a podcast that I have called Mentally Chill, Diagnoses, Neuroses, and Everything Between. And this is my 20th episode. And I'm talking about how lately I've had to go on short-term disability from work for my mental health issues. And it's not something that I'm super happy about, but something that was totally necessary. So welcome in, and look forward to you joining the chat. So you might notice a sound or some movements. My hands and my leg involuntarily shake. I'm having some involuntary facial movements, although they've gotten better as we've started to wean me off the medication. They still are affecting my limbs and extremities, unfortunately. So, hi, welcome in. I'm talking about mental health today and kind of where I'm at. So I have been really struggling with a lot of things surrounding this disability, surrounding this time in my life. I am facing not the deepest depression I've ever felt, but I am definitely dealing with depression. And for those of you who don't know, I'm bipolar. In addition to that, I'm borderline personality disorder. I have PTSD. I think I have ADHD. It's hard to diagnose both ADHD and bipolar at the same time because there's so many overlapping symptoms, blah, 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 blah. That's the technical medical terminology, blah, 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 blah. And Um, I let's see. So, this is not the worst depression I've ever faced, but it's definitely been hard as I haven't really been depressed for a long period of time in quite a while. Um, Lately, in the past couple of years, I've swung up or I've been at baseline. Um, but this depression feels more all consuming. You know, some depressions feel like a dark cloud that follows just me. And this depression feels like the whole world is just dark and there's no hope. And so I guess it just feels different whereas I feel like other depressions have felt like I'm depressed and everyone else is happy. I feel like there's just no hope anywhere, and um, I'm just going to be miserable, no matter how things shake out. And that's just kind of a sad look on life, but it's what's going on right now. I luckily have not felt the need to self harm or I haven't had any suicidal ideations. It's just, I feel like there is, there are limited opportunities for me in this life, and I'm trying to make things like YouTube and crocheting and crafting my job so that I can lean back on something, because right now I feel like I have nothing to lean back on and I feel pretty um, existentially sad, I guess. So it is what it is. Um, I am not doing this out of, desire for pity or, anything like that. I just wanted to do a check in to talk about how how I've been affected and how um, this kind of came about. My I'm still a big fan of medicine. I believe that medicine can help so many people. Not everyone needs to be on medicine. I'm definitely one of those people that, due to my diagnoses, needs to be on medicine. However, I am really questioning my doctors and why I'm in the position I'm in again. It was such a devastating blow to deal with what I dealt with in the fall, um, to almost lose my job and then to come back to work and almost lose my job again and have to be under this, um, microscope of performance. Was really, really hard, and I couldn't take it. I couldn't mentally, emotionally take it. I was having anxiety every day, which was, you know, quadrupling the effect of my symptoms. And I was just having such a hard time doing anything that getting anything done in my job was just near impossible. And, disability for me became the only option very rapidly, and I stuck with it as long as I could. But I was doing things at my job that were so, like, I was making such simple errors, but I was making them all the time, that it just was like, what is going on? And I know people started to not like to work with me, and um, all of that's really, really hard and just kind of compacted and compiled to make it really difficult um, to work. So I guess that's the broadest summary of my mental health that I can give. I've been much happier since I've not worked. It's made a huge difference in my anxiety levels, although I'm still having panic attacks. And oh, did I mention I have an anxiety disorder? Um, it's definitely lessened my panic attacks and lessened the intensity of them, but I'm still having them. And I've been very irritable, which sucks because it affects the people around me. Um, so I suffer from depression. It sucks. Yeah, it does, Zach, and I'm really sorry that you do. Um, it is a really difficult diagnosis to have. But the good thing about depression is that it doesn't, and any mental illness, is that it doesn't define us as people. We still can lead happy lives. Look at me trying to like bring you up, and like literally I'm just telling myself that like I'm never gonna amount to anything because I'm mentally ill. So, isn't that ironic? Um, so I'm sorry that you suffer from depression. Yeah, I totally understand not wanting to get out of bed. I have had days like that and I haven't gotten out of bed. So the fact that you still do get out of bed is something to look, um, not look forward to, but to commend yourself for. And I'm sorry that, again, that you're dealing with that because it's not fun. Um, I would say trade you, but that's not that's not any more fun. I wouldn't do that to you. Um, so I um, I've been, like I said, was saying, I've been happier since I've been on disability, but I have to keep my mind and my body busy all the time. Otherwise, I slip into this depression even further. And um, little things that shouldn't matter begin to consume my whole life. And I just get so down on myself. And, um, I get so hopeless about the future and what it will hold. And those days are really hard. Um, for me, sometimes they're full days, sometimes they're weeks, sometimes they're just minutes. So it really can vary in time on how long these depressive dips last. And, that's just kind of part of the game. But I have my DBT skills, my dialectical behavioral therapy skills to use. I just haven't been great at using them because when I feel bad, it's easier for me to use them when I feel elevated rather than when I feel like depressed. Um, because I'm just like, nothing's gonna work, nothing's gonna help. I'm just gonna feel bad forever, and that's gonna be that. And it doesn't have to be like that. I can use my skills, um, or I can use my CBT skills, my cognitive behavioral therapy skills to kind of stop thinking in black and white and see things for how they are and all that stuff that I went to treatment for many times and hopefully should learn by now. Um, so that's where I'm at right now. I'm doing all right. I'm not doing great. I am suffering from some gender dysphoria, which I've had some people in a trans Facebook group tell me that it's normal and those feelings will pass, and to take some self-care time to um, to you know relax and not be so hard on myself. I think I just want so desperately for the process to just hurry up, and I want to um, just be able to be identified as a guy by other people. I'm looking so desperately for validation from other people that I am a man, that I just, I don't know, that I have to, you know, I don't know. I like stayed inside. We were gonna go somewhere, go to a little local event, and I didn't go because I didn't want to be misgendered. I'm tired of being misgendered, and that seems to be all that happens when I go out. And um, I need to be more gentle with myself and with others. And I'm not mad at people for misgendering me. So please don't mistake that for like people who accidentally use the wrong pronoun I'm like mad at or anything like that. That's like absolutely not the case. I just, there's just, it's disheartening because I will be dressed as a man. I will be, um, I look like a guy, except my freaking um binder can only do so much because I am blessed with a chest, and um the binder really only brings me down a cup size or two and smushes them down. Um, but I look like a guy. Tons of guys have um, fat there, so it shouldn't be a huge deal. But the minute I open my mouth, because I'm effeminate, people just assume that I'm a woman, and it just sucks. Um, so I I need to stop being so sensitive to it. When that will happen, I don't know. Um, but I need to be more gentle on myself and on others. I know, and maybe that'll help with some of this depression that I'm dealing with. So I hope you guys enjoyed this. I hope you're having a great day, night, evening, morning, wherever you are. And I don't even remember how to sign this out. So I hope you guys are doing great, and I will talk to you guys very soon. Love you. Bye. So that was me recording a podcast. Um, I hope you guys enjoyed it. And um, that's me talking about my mental health at this point in time. Um, I will post this podcast if you want to listen to it. If you're just catching the tail end of it. If you prefer to listen to podcasts um, instead of watching videos. Either way, it works. So I hope you guys enjoyed it, and I'll talk to you later. Bye.